Good morning. This is Dr. David Snopoulos, one of the co-editors on the Fits on the Go blog. I am privileged to be with Dr. Phillips here at the ACC 2015 Legislative Conference. Thank you so much for joining us today.
Thank you.
Dr. Phillips, can you please talk to us a bit about MACRA and what that entails?
Well, thanks for inviting me. Basically, there's been a shift over the years to say that physicians should be compensated and the healthcare system should pay for quality of care, not necessarily volume of care. The concern is if you align the incentives around volume, that you'll get more of it, not necessarily in the patient's best interest. So the idea is, how do you reward professionals for providing quality care? So going forward, that is the plan. The government wants to see that 90% of all physician payments by 2018 are more geared to quality of care. This is a sea change because right now physicians for the last 30 years have been paid on quantity, specifically the RVU, relative value unit. Each unit of work is assigned a financial value. The more units you do, the more you're compensated. So this is a total change in the whole method of reimbursement for the physicians and hospitals of America.
In about 5 to 10 years from now, how do you think this will change the practice of medicine, particularly cardiology?
Well, I can't figure out what's going to happen 2 years from now, unless 5 to 10. I guess here's what I would say. I believe most physicians are trying to do the right thing, and most physicians do the right thing when they have the available information, and in their busy day, we like to say, when they remember to do the right thing. I think with the advent of electronic health systems and data, as that gets better, with the dissemination of guidelines, with the more transparency of outcomes, the care will improve. And if you look what's happened over the last 30 years, mortality from cardiovascular disease has declined almost 30%. So we are doing a good job. I think it will help. If I'm a career professional, I do think there's something onerous about going to work and being told you're basically on an assembly line, and unless you produce a certain number of units of work, your pay is reduced. I think aligning pay towards outcomes seems to be a good idea. The challenge is, how do you do it? And honestly, I wish I knew how that transition is going to be made. If it works, what I would see in several years, that physicians are paid basically on adherence to guidelines. You know, you get most of us, if you ask, how many patients with hypertension have well-controlled blood pressure? The standard answer for most doctors are most of them. Is that true? We don't know. How many patients who should be on a statin are taking a statin? The answer is, we think a lot. Ask the doctor to tell you the number, they go, I don't really know. How many people who should be on antiplatelets are on antiplatelets? The answer is, they all should be, except a lot of them are not. Eventually, we'd like that answer on our fingertips. Now, most people will go to the exception and they'll say, well, they'll always tell you about this patient or that patient who can't take a statin, or this guy who bled. That's not what they're looking for. They're looking for the majority of the people who meet indications for certain treatment are getting that treatment. And I think as professionals, we need to know that. We'd like to know that. I'd like to be able to say that. Hopefully, with the data systems that are coming in, once that data is available, and then rewarding people as professionals for doing a good job.
One last question. What advice can you give to young professionals in cardiology, and particularly the fellows in training, in advocating for their college and for their future?
Oh, great question. Here's what I'd say to a fellow if you're starting out. The biggest mistake we made as a profession is we stayed out of it. We said, as physicians, we shouldn't get involved in the political process because we don't want to bias our patients. Huge mistake. What each fellow needs to do, and if each fellow did this, the world would change. Go find out where you're going to live, find out who your congressman is, call them up, make an appointment when they're back in town. Go in their office. It doesn't matter whether you agree with them or not. Say, I'm a new cardiologist, I'm in your community, I'm a constituent. I'd like to know you. I'd like to be a resource for you. I'd like to share with you what's going on with my practice and my patients so we could work together to improve patient care. Call on me, I will be available. If every cardiologist knew their legislator face to face, and if every legislator knew their cardiology constituents face to face, the world would be a different place for us right now.
Very true and absolutely phenomenal advice. Thank you again for joining us today.
Well, thank you so much for inviting me, and good luck to everyone.
Thank you. To get more coverage on the ACC 2015 Legislative Conference, please join us at www.youtube.com/fitsonthego.